like to welcome you all to the 6-month progress report on my PhD thesis, which is focusing on the efficacy of safety of proton pump inhibitors. My name is Elena. I'm a second-year trainee in gastroenterology and a PhD student here in the Center for Translational Medicine and at the Grigore Popa University of Medicine and Pharmacy, Iași. And together with my team, my two supervisors, Balint Eroș and Vasile Liviu Drug, my SMS Mahmoud, and our statistician Dani Vereș, we aim to improve the clinical management of patients with gastroesophageal reflux disease, and the way we plan to do that is by assessing the efficacy and safety of acid-suppressive drugs. We have initiated 2 projects. The first one is investigating the therapeutic effects of acid-suppressive medication in adults with nonspecific chronic cough, whereas the second one aims to evaluate the risk of Clostridioides difficile infection in patients treated with proton pump inhibitors. Allow me to get into a bit more detail on my first project, which started in September 2022. As most of us know, the Montreal Consensus recognizes chronic cough as a potential manifestation of extradigestive gastroesophageal reflux disease. And it's a very important topic because it has a high global prevalence, estimated to be around 9.6%, and is a significant cause for quality of life impairment. Acid-suppressive medications have been proposed as a potential therapeutic strategy for this clinical entity. However, studies still yield inconsistent results. This paucity of evidence is recognized even by the most current guidelines on this topic. Therefore, our aim was to assess the therapeutic efficacy of acid-suppressive drugs in the treatment of nonspecific chronic cough. For this, we employed the PICO framework, where the population is adults with nonspecific chronic cough, and the intervention is acid-suppressive medications compared to placebo. The main outcomes of interest were the impact on cough severity and on quality of life, and we hypothesized that there's some benefit to acid-suppressive treatment in patients with nonspecific chronic cough. We have conducted our systematic search on the 1st of November 2022 using this search key, which was comprised of 3 main domains. The first domain was related to chronic cough, the second one to the acid-suppressive medication, and the third one to the concept of randomization, as we only plan to include randomized controlled trials. In this slide, you can see our flowchart of selection. In the end, after the screening and selection process, we have ended up with 11 eligible articles. Allow me to present some of our main results. The first figures shows the mean change in cough severity in patients with nonspecific chronic cough receiving proton pump inhibitors compared to placebo. This is a very important topic because, as mentioned previously, epidemiological data suggests there's a high global prevalence of chronic cough and it causes significant quality of life impairment. Our measure of effect was the standardized mean difference, and just as a quick tip for interpreting our results, we considered that a standardized mean difference between 0.2 and 0.5 is a small effect. A standardized mean difference between 0.5 and 0.8 is a moderate effect, whereas a standardized mean difference greater than 0.8 is considered a large effect. As you can see here, the standardized mean difference is 0.33, which could be translated as a relatively small effect. However, it is mathematically proven as the confidence interval does not touch the line of null effect. Our analysis has included 9 studies, all double-blinded, placebo-controlled, randomized trials, which total around 350 patients. The population was rather homogeneous. You can see that the heterogeneity is only 16%, and that is probably due to the strict inclusion and exclusion criteria. So to conclude this first plot, we can say that there is some small mathematically proven benefit in reducing the cough severity in patients with nonspecific chronic cough, favoring proton pump inhibitor treatment. We have also conducted a subgroup analysis, as we have 4 studies that include patients with chronic cough only, and 5 studies that include patients with laryngopharyngeal reflux, which may present as chronic cough. And as you can see here, there's no statistical difference between the 2 subgroups. We have also performed a time dependency analysis, which aims to investigate if the efficacy of the proton pump inhibitor treatment is influenced by the treatment duration. On the y-axis, you can see the improvement in cough severity as represented by the standardized mean difference, whereas on the x-axis, you can see the duration of treatment in weeks. And as you can see from this plot, there's no significant relationship between symptomatic improvement and a longer treatment duration. One of the main strengths of our study is the fact that we studied the effect of proton pump inhibitors in patients with nonspecific chronic cough, both on cough severity and on the quality of life. And we also provide additional insights on the basis of subgroup analyses and time dependency analyses. Moreover, we have a very homogeneous study design, as we only include double-blinded randomized controlled trials, and we have followed a very rigorous methodological approach which further supports the validity of our results. However, there are a few limitations as well. We have a relatively small number of included patients, and all outcome measurements were subjective using varying scales and questionnaires, and not all of them were validated. Basically, we have reached two main conclusions so far. The first one is that treatment with proton pump inhibitors can result in modest symptomatic improvement in patients with nonspecific chronic cough, and that this effect does not seem to be dependent on the duration of administration. In clinical practice, that could mean that PPI treatment could be beneficial in selected patients, and no benefit can be seen from an extended treatment duration. In terms of implications for research, we suggest that further RCTs are conducted with appropriate sample sizes, and objective cough monitoring tools are employed, as well as maybe investigation of other potential acid-suppressive medication, such as potassium-competitive acid blockers. Here you can see the progress of our first project. We are currently almost done with all the figures and all the calculations, and we're still awaiting the data on quality of life. And we are in the process of writing the manuscript, which we expect will be ready for submission somewhere in the beginning of April to one of our top 3 journals. Allow me to discuss a bit our second topic as well. Our second topic was started in March 2023. As we all know, PPIs are probably among the most frequently prescribed drugs worldwide, and there's an increasing trend to this. And estimates from Spain say that 1 in 10 people is daily PPI user. An increased risk of Clostridioides difficile infection has been described in PPI users, with up to a 2-fold higher odds compared to non-PPI users. However, these results only come from observational data and could be the result of residual confounding and other additional biases. Therefore, our aim would be to investigate the risk of Clostridioides difficile infection in patients with PPI treatment, however, in the context of randomized controlled trials. For this, we have employed the PICO framework. The population is adult patients receiving PPI treatment comparing to patients who are not receiving PPI treatment, and the outcomes would be the rates of Clostridioides difficile infection, and we hypothesized that PPI treatment does not increase the risk of Clostridioides difficile infection in these patients. This way, we aim to explore the safety profile of PPI medication. We have conducted our systematic search on the 2nd of March 2023 using this search key, which is comprised of 2 main domains. The first one is related to proton pump inhibitors. The second one is related to the concept of randomization, as we only plan to include randomized controlled trials. You can see here the flowchart of selection. We are currently at the state of title and abstract selection, and we have went through around 10% of the total number of hits. In summary, we plan to submit the first article somewhere in the beginning of April, whereas we estimate that the second project will be ready in the summer of 2023. And I would like to end this presentation with a quote from Franklin D. Roosevelt, which says that a smooth sea never made a skilled sailor. Thank you for your attention.
I would like to ask regarding your first topic, if you have any data regarding the dosage of the PPI, or if you observe any dose dependency on the effect.
Thank you for your question. We have various doses. Some of the studies use once daily, others use twice daily administrations. We plan to do a subgroup analysis based on that, and we are waiting to see if the statistical part is is adequate, if that can be performed. That was one of the mentions we made in our Prospero registration, so we plan to look at that as well and see if the calculations are possible, yes.
I have a question regarding your second topic. You didn't mention, is there any previous meta-analysis on this topic, because it's quite a hot topic these days?
Thank you for your question. Yes, there is a previous meta-analysis from 2017, which was done on this topic. However, it is only based on observational data, and as I said, that could be the result of residual confounding and other biases, and so therefore we plan to do that only in the context of randomized controlled trials.
I have a practical question to you. What would you advise? What kind of, or how long would you prescribe PPI for somebody with a chronic cough, based on your data?
Yes, thank you for your question. Personally, I think that maybe a treatment duration of 6 to 8 weeks would be enough, given the fact that no additional benefit was observed with extended treatment duration up to 12 weeks. So I think that maybe 6 to 8 weeks could be enough to see if the patient responds and if the cough improves.
You were talking about in first project only about PPI, but in the search key I saw that there's some H2 receptor antagonist, and what about these groups of the medications?
Yes, thank you for your question. The plan was to assess all acid-suppressive medications, including H2 blockers, PPIs, potassium competitive acid blockers. However, data was only available for PPIs, no data on the newer ones, the potassium competitive acid blockers, and not sufficient data on the H2 blockers. So the only available literature was on PPIs.
My question is also a little bit search key related about your second project, because it's a quite focused question with a lot of initial hits. And I'm sure you went over the search key when designing it with Mahmoud and with the supervisor. And what is the reason why you left out the search words of Clostridium and the related words?
Yes. Thank you for your question. We initially thought of that because of the huge number of hits. However, we do know that it is not recommended to include the outcome in the search key. As a very practical example, we have found an RCT that does report the rates of Clostridioides difficile infection, however, only in the full text and not in the abstract. So that article would have been missed with a search key that included the concept of Clostridioides difficile infection in it. And that is why we decided to be as thorough as possible and just include the medication, the PPI, and the concept of randomization and go through all of the hits.
I actually don't have a question. I just want to congratulate, because this is a very perfect study, very useful study, and I would like to highlight the fact that you enrolled the placebo-controlled trials there. So one more congratulations. I think this will bring much more light to this topic. Thank you.
Thank you.